many of you know, have a relative, or know someone who lives in a nursing home? My name is Julian Van Clay, and today I'd like to talk to you about the importance of animal-assisted therapy, and I want to encourage all of you to petition to have it in a nursing home near you, or all nursing homes. I have visited many different nursing homes in my life, and I've heard first-hand accounts of nursing homes from my mom and from my sister. This topic is important because how we care for those before us influences how the generation behind us takes care of us. Today I'll be talking about the physical, the social, the emotional effects of animal-assisted therapy, and also what therapists think of animal-assisted therapy. My first point is the physical effects. According to the benefits of pets and animal-assisted therapy of the health of older adults by Paul Cherenick and Ariel Cherenick, when data from the subjects who were exposed to fish tanks was put together, there was a 1.65 weight gain. This is good because most older adults tend to lose weight, especially in a nursing home setting, so gaining weight means that they're relaxed and healthy. For physical effects, if they suffer from depression, they might not eat, which could lead to an earlier death. Having dogs, cats, fish, whatever kind of pet you want, encourages the patients to get up and move around, to interact with the animals, and just to be alive. A recent analysis of a cohort of 545 Scottish participants, and they were all at least 65 years older, dog owners were more likely to report themselves at the highest level of physical activity than those who didn't have dogs. And this could mean that they have lower medication than people who don't have dogs and a little bit more healthier. Okay. For social effects, the major stressors for older adults are death of spouses, moving, children growing up, financial status, what do they do every day, their friends may have moved to different nursing homes or die, just a lot of changes as you age. The social side of animal-assisted therapy is one of the top reasons to implement it. It helps a patient feel a part of something and creates a community in the nursing home environment, which would also add to the quality of life for the patient. According to Cherenick, one might speculate that animals might create a distraction to inhibit disruptive behavior or serve as a surrogate for human interaction to learn or practice social behaviors. So it's another thing or person to interact with and not having just to rely on nurses or sporadic family member visits. Alright. On to emotional effects. I like this one the best. Animal-assisted therapy is viable for emotional health of the patients, according to Nancy Hudson. Participants who were withdrawn, lacked initiative, and had flat affect, meaning they have no visible personalities per se, had increased interactions with the dog and other participants. So when they played with the dog, they seemed happier, they engaged more. An improvement in patient emotional health is not only good for the patient, but also it's good for the staff who work with the patients, the family who visits the patients, pretty much anyone in contact with the patients. If the patient's happier, everyone's happier, the administration, staff, family. According to Ms. Hudson, the stakeholders, which would be the staff, family, and admin, and the residents of the facility, their families, and nursing staff. So the more that the patients are happy, the more everyone's happy. For therapist view, according to Ms. Bellanger, more social workers are finding that animals are good assistants in the therapeutic process because of the human-animal bond. I think we should give all the therapists the opportunity to have animal-assisted therapy with them so that they can build this bond with their patients. In conclusion, I want to remind you all of the positive effects that animal-assisted therapy has. Physically, it encourages patients to move and become active. Socially, it creates a sense of community and gives purpose to life. Emotionally, animals calm and decrease anxiety in geriatric patients. And finally, the therapists themselves find the animals useful and purposeful. In conclusion, it's our joy and responsibility to take care of the people who took care of us. So, thank you.